Hello, I'm Dr. Yatros from Dental Sleep Solutions, and welcome to this edition of Dental Sleep Medicine Insider magazine. Today I'd like to talk about common challenges to getting your dental sleep practice up and running and successful. Over the last couple of years, we've been concentrating on helping dentists across the country, and we've even been going into some of their offices and giving them more of a hands-on approach in what we call our DS360 Premier Tier program. And what we found are there's some very common problems that each office faces in achieving dental sleep medicine success. They're focused around communication, screening, testing their patients, having systems in place, verbal skills, and really it comes down mostly to talking to the patients about something that maybe is out of their comfort zone. Coming up in the North American Dental Sleep Medicine Symposium, I'm going to be talking more in details about a lot of these, but I'd like to talk today about, at a high level, what all of these have in common. Really, we go back to our four pillars: screening, testing, treating, and billing. If you can do these dental sleep medicine procedures in your office and have team members who are ready to help you with these tasks, you'll be highly successful. Then why do we have these challenges? And what we've learned is really it comes from the top down. It comes down when a patient says, no, I don't want to have a sleep test, or no, I don't want to go forward with treatment. Why are the patients really saying this? It comes down to our offices understanding that this is our jobs to do this. And I think really at a high level, we have to embrace that this is what we want to do, and furthermore, it's our job. And I've been saying that for many years, and as of a couple of years ago, the American Dental Association came out with their new parameters as far as dentists being involved in dental sleep. And now guess what? The ADA says, as a dentist, you should be looking at your patients and deciding if they're at risk for sleep disorder breathing. And it's your job to get those patients to appropriate physicians to be tested. And so when a patient comes in our office and you screen them and you say, oh, they're at risk, but maybe they're not getting tested, we have to look back at these practices and go, why aren't they being tested? Is it that we don't have adequate systems? Is it that sleep testing is expensive? It's difficult? Well, all those may be true to some degree, but it really comes down into your office's belief that this is my job. An analysis that I give a lot of the offices, or analogy rather I should say, is imagine that patient had a big ugly lesion in their mouth and it looks like it could be really concerning. How many of those patients would you get to go to an oral surgeon, or you yourself would do a biopsy on? Would most of those patients go? Well, it's going to cost a few $100s. They're going to take a piece of this patient's body away. If your answer to that is, yes, I get most of my patients with something I'm really concerned about to go to get a biopsy if we think that they may have oral cancer, but you're not getting your patients down the pike of sleep testing, it's because of the belief system in your office, that you and your team believe it's your job to get them to do this, and you're concerned about the patient. So it starts with your belief. And I think if you, as a team, sit down and go, look, we can't ignore periodontal disease. We can't ignore oral cancer. And know what? We cannot ignore people who are at high risk for sleep disorder breathing, and it's our job to get them to be tested. You're going to find that this whole process is going to get jump-started. So again, there's a lot of challenges here that we can go through when it comes to treating dental sleep medicine. And really the beginning of it is accepting that it's our job to do this. Once we believe in this, our patients will trust us, and then all we need are systems to implement testing and treating our patients. We can help with all of that here at DS3, but I think if you can make that first hurdle, all the rest comes easier. So I know that's a really high-level conversation, but believing is the first step. I'm happy to discuss this more with you at the North American Dental Sleep Medicine Symposium coming up February 15th and 14th in the beautiful Clearwater, Florida. We'll go into more details about some of the other hurdles that we've noticed, but let's make that first jump before you get to the symposium. And again, I'm Dr. Yatros with Dental Sleep Solutions and DS3, and thanks for taking your time to watch and read this edition of the Dental Sleep Medicine Insider magazine.